the persons who were very much eager to join in fashion show, they want to show their collarbone. But in our respect, there is no such importance. Rather, we are clinical aspect of it. We are concerned with the clinical aspect of this bone. And you know, this is the bone which is placed junction between the neck and the superior extremity, or there is a space which is called the axilla of the superior extremity, and this is the neck. So, it is at the junction point and it forms a member of the components of a particular girdle, that is called pectoral girdle. Okay, in pectoral girdle, we can see this is a part of the bone which forms the pectoral girdle. They are, one is clavicle and another is the scapula. In the pelvic girdle, similarly, we get the hip bone, which has got three components: ilium, ischium, and pubis. And whereas in pelvic girdle, we get these two components. We know this is the scapula and this is the clavicle. Now, this clavicle, already we know that is, this is a modified long bone. Long bone definitely, because due to its shape and size and due to the fact it bears the weight of the body. Okay. But there are some dissimilarities, because it is, the long bones are placed vertically in our body. It is the bone which is placed horizontally. All the long bones, they have got primary center and the secondary centers. And the primary centers in long bone, actually ossification, the primary center of ossification appears in a cartilaginous model in long bone. But unlike long bone, here we get the two primary centers for the body. This is the body. Two primary centers. In the long bone, we get single primary center. And that two primary centers are membranous. They appear in membrane. This is the first bone where we get the commencement of ossification. That means two primary centers for the body appears at 4 to 5 weeks. That means 20 days or 25 days. Okay. And these two primary centers gets ossified at around 45 days. So, this is the bone where we get ossification first. Though, as per law, and here, no, not as per law, there is, I will discuss about the laws of ossification. And this is the last bone where we see the complete of the ossification, completion process of the ossification. Okay. So, this is modified long bone because of the fact this is long bone, but modified because two primary center of ossification, that two appears in membrane, horizontally placed, and it does not have any, generally we do not get any medullary cavity, and also a cutaneous nerve, supraclavicular nerve, which the intermediate division of the supraclavicular nerve pierces this bone, and this is called, and this is subcutaneous in nature. Long bones are, do you think the long bones are subcutaneous? No. So, and also the intermediate division of the supraclavicular nerve actually pierces this bone. So, this bone is also called a dermal bone. Okay. Now, what is the anatomical position? Before that, we have to know some important points, that is the ends. It has got body or the shaft and two ends. One is sternal end and one is acromial end. One is sternal end, okay, towards the sternum, and another is towards the acromial process. This is a this is the acromial process of scapula. There are some process. This is coracoid process, acromial process, spinous process. So, there is an articulation between the clavicle and the acromial process. So, this is the acromial end, and this is called acromioclavicular joint. And another process, another end with joins with the sternal end. That is the this part of the sternum is called the manubrium of the sternum. Then this is the body and this is the xiphoid process. Hey, Vivek, এই sternum পুরোটা দাও, এটা অর্ধেকটা দিয়েছো। হ্যাঁ হ্যাঁ হ্যাঁ, এটা কি দিতে যাচ্ছিলে স্যারকে? So, here is the articulation. Sorry, here is the articulation. Okay. So, between the sternum and the clavicle. Okay. So, this is the sternal end, and this is called sternohyoid joint. Both sternoclavicular joint and acromioclavicular joint, both are synovial joint, because the synovial joint is the joint where we get the free or to some extent, to a better extent, we get the mobility. The mobile joints are the synovial joints. Okay. So, this is plain synovial joint, and this is also a synovial joint, but this is a complex synovial joint, because in between the joint there we get a partition of there is an articular disc is there which separates these two joints. This joint is one, but is divided by an articular disc. So, that is called complex synovial joint. Okay. Like temporomandibular joint. Here also we get the complex synovial joint where we get the articular disc which divides the joint cavity. So, this is the sternal end and this is the acromial end. Now we can see it looks like the figure of F. Looks like the figure of F, this bone. And we can find this is the right-sided clavicle. Why it is right-sided clavicle, I will explain. Now, if we superimpose with this bone, we can see this is right-sided. Now, we can find the body has got a curvature. The medial two-third, in the medial two-third, there is a convexity forwards. Convexity forwards. And in the lateral one-third, we get the concavity forwards. Clear? Now, first we have to identify which one is sternal end and which one is acromial end. The sternal end, you can see this is quadrangular in shape, whereas the acromial end is flat, where we get a plane area. Plane. We can find a plane area. You can detect a plane area on the acromial end. This is for the articulation with the acromial process. Okay. And here we are getting a quadrangular shaped area, and the acromial end is flat, and which bears a facet. This plane area is called the facet. Facet. Okay. For the acromioclavicular joint. Okay. So the body has got medial two-third and lateral one-third. Medial two-third convexity forwards, and in the lateral one-third concavity forwards. Medial two-third, we can see the cylindrical body, and the lateral one-third flat body. Okay. In the medial two-third, we get several surfaces, like one is facing towards you, that is the anterior surface. One surface is facing me, that is the posterior surface. One surface is facing upwards, that is the superior surface. And one surface is facing downwards, which is called inferior surface. Here. Whereas the lateral one-third has got only superior surface and one inferior surface. Clear? বুঝেছো এতটা? Now we can get some impressions. If we see the medial two-third, we can get an impression or a muscular impression here, the one muscular impression on the anterior surface. Okay. That is by the, we know there is one muscle which takes origin both from the sternum and from the clavicle, which looks like, which is triangular in shape, which both takes origin from the clavicle and from the sternum, and it is inserted over the humerus. That big muscle is called pectoralis major. So, pectoralis major muscle gives a muscular impression or indentation on the anterior surface. Which fibers of the pectoralis major? Pectoralis major has got sternal fibers and clavicular fibers. Only the clavicular fibers of the pectoralis major creates an impression in the anterior surface. So, this anterior surface bears the impression of pectoralis major. ঢুকলো একটু? Another muscle which takes origin from here, and that muscle is inserted over the occipital bone. One muscle here and one muscle from here to here, and we can find this muscle. This muscle is called sternocleidomastoid. That means it takes origin not only from the clavicle, also from the sternum. This impression is for that muscle, that is called sternocleido. Cleido means clavicle. Mastoid. There is a mastoid part. Okay. That is also in the occipital bone. There is a superior nuchal line, and also there is a mastoid process which is present in the temporal bone. So, it is inserted there. Okay. So, sternocleidomastoid, and that impression goes up to the superior nuchal line of the occipital bone, also the insertion. So, that is the sternocleidomastoid. So, the superior surface is for the origin of the sternocleidomastoid, by which we can move the neck to the opposite side. If you want to resist, you can see this muscle becomes taut. If you resist it, you can see the opposite muscle becomes taut. That is called sternocleidomastoid muscle. And this sternocleidomastoid muscle is very important, and many a times we have suffered from torticollis. When there is a spasm of this muscle, you cannot move your head. And this muscle is supplied by a very important cranial nerve, that is called spinal accessory nerve, 11th cranial nerve. First cranial nerve, second cranial nerve, third cranial nerve. Can you tell me the name of the third cranial nerve? First cranial nerve, anybody? Olfactory, ওই তো বলেছে, olfactory. Second, yes, বলো, কে বললো? Optic. Third, oculomotor. Fourth, trochlear. কে বললে? এখানে লজেন্স খাওয়ানো উচিত, তাই তো? কে বললো? তুমি। একটা লজেন্স পাও না থাকলে। Fifth, trigeminal. Sixth, abduction. সব দেখতে পাবে during your dissection process, you will see abduction. Seventh, না থাকলে we cannot express our facial impressions. Facial. Eight, vestibulocochlear, auditory nerve, and also the vestibular component which has got. 9, glossopharyngeal, for the posterior 1/3 of the tongue and also for the pharynx. 10. Vagabond. That is the vagus nerve. Starts from the brain and goes even inside the abdomen and travels like a vagabond. Vagus. Vagabond's nerve. 11. Accessory, which has got spinal component and cranial component. And the next one is for the tongue, hypoglossal nerve. So that muscle, that sternocleidomastoid muscle is supplied by spinal accessory nerve. And there is all sensory components are coming from the cervical plexus, that is the C2, C3 components, which is sensory, which bears the sensory, but the motor action by the motor component is by this movement is the motor movement. Sensory means any sensation it is having. So motor component is by the spinal accessory and sensory component of the muscle, because there is also muscle sense, it bears the muscle sense also, that is by the cervical plexus, that is the anterior ami of C2, C3. ভুলে যাও, মুছে দাও ওটা আবার, মুছে দাও, erase করে দাও, because that becomes too মানে indigestible. So sternocleidomastoid and pectoralis major. So pectoralis major from the anterior surface and sternocleidomastoid from the superior surface, and that sternocleidomastoid also has got origin from the sternum like the pectoralis major. You know, pectoralis major is taking origin from here, so sternocleidomastoid is also taking origin from here and from here. Okay, and pectoralis major is from here and from the anterior surface. So you can encounter two muscles. Now on the posterior surface, this is the posterior surface. From the posterior surface, one muscle is taking origin, and there is one bone which is called hyoid bone, which is missing. Above the thyroid cartilage, there is a hyoid bone. If you go below the chin, you can find one bone, that is the hyoid bone. Then the thyroid cartilage. The thyroid cartilage is very popular now, because thyroid cartilage and the hyoid bone both were fractured in case of strangulation, in case of throttling, and very unfortunately it happened few months back, for which we were all very much irritated. So both the hyoid and the thyroid bone, at least the thyroid bone was fractured. So this is the hyoid bone. So that muscle actually takes origin from the posterior surface of the sternum and also from the posterior surface of the clavicle, and it goes upwards. It's a strap muscle, straight muscle. From here it goes up to the hyoid bone. So name of the muscle should be from the sternum to hyoid. Sternohyoid. So that muscle takes origin from the posterior surface. Okay. In the inferior surface of medial 2/3, the inferior surface of the, we are complete with the anterior surface, superior surface, posterior surface, then the inferior surface. In the inferior surface, towards the sternal end, we can find a rough area. This rough area in the inferior surface of the medial 2/3, we get a rough area. দেখো বোনসটা কোথায় গেল? দেখো there is an rough area. This rough area is for attachment of one ligament from clavicle to the first rib. We can see this is the first rib. From clavicle to first rib there is one ligament. What is the function of the ligament? It ties two bones. In the joint we get the ligaments. In the elbow we get the lateral ligament, medial ligament. So they actually are as a binder. So between the binding between the clavicle and the first rib, and we can see in all the ribs the medial part is transparent, and this here we are getting the rib, but medial part is transparent. This is the cartilage. Medial part, the transparent area is called the cartilage, which is called the costal cartilage. First rib, first costal cartilage. Second rib, second costal cartilage, like it goes on. So that ligament is in between the clavicle and the first costal cartilage and the first rib. So the name should be from the costal cartilage to clavicle, costoclavicular ligament, and which creates a rough impression in the inferior surface. বুঝেছো? And on the inferior surface, in the medial 2/3, we get a groove or depression, linear groove, okay, or depression. এই জন্য বোনস দরকার, বুঝেছো? বোনস ছাড়া না এগুলো মাথায় থাকবে না বেশি দিন। We can find a linear groove. হাত দিয়ে দিয়ে বুঝতে হবে। This groove is called the subclavian groove. We can find a linear groove. In the medial 2/3 we get a linear groove, which is called the subclavian groove. দেখতে পাচ্ছ? হাত দাও। এই দেখো, এইটা এখানটা ডিপ্রেশন দেখেছো? দেখতে পেয়েছো? দেখাচ্ছি বাবু। না বাবু, এই দেখো, এই যে গ্রুপটা দেখো, ইনফিরিয়ার সারফেস, এই যে ইনফিরিয়ার, এটা সুপিরিয়ার। এই গ্রুপটা দেখেই আমরা বুঝতে পারি এটা ইনফিরিয়ার সারফেস। সাবক্লেভিয়ান গ্রুপ, that it is the inferior surface. This groove is for attachment of the muscular part of a muscle, that is the subclavius. Sub means below clavicle, so subclavius. Each and everything has got meaning. Sub means below the clavicle. This muscle takes origin from the first rib, and that from the first rib and from the first costal cartilage, and that origin is tendinous origin, and it becomes fleshy, and fleshy part is inserted here. Okay, tendon, it takes origin as a tendon from the first rib and from the first costal cartilage. From the first rib and from the first costal cartilage it takes origin and it becomes fleshy and ultimately it is inserted over the subclavian groove. Clear? This is a triangular muscle taking origin from here. Okay, and very important muscle because you will see the dissection of the clavipectoral fascia from the clavicle to pectoralis minor. One fascia is there. Okay, that in that region we will get this muscle. This is called subclavius muscle. And there are some lips of the group. Lips means there are some anterior part and posterior part. So we can find the anterior lip and posterior lip of the subclavian group. Lines. Lip means lines. One anterior and posterior. From anterior and posterior, one fascia will come out. One fascia will take origin like this. Here we are getting the attachment of the subclavius muscle. Okay, and here we are getting this is the anterior. If we, this is the clavicle. Okay, this is the superior surface, and if we make it inverted, then this is the this is the lower surface. So this is the anterior lip and this is the posterior lip, and this here we are getting attachment of one fascia like this. It has got anterior part and posterior part of the fascia, and they get united below and is continued. That fascia is called the clavipectoral fascia. Clavipectoral fascia, because there is one muscle which takes origin from here, which remains at a deeper plane. The superficial muscle is pectoralis major, and there is a small muscle which is also taking from origin from the chest or from the ribs. So that is called pectoralis minor muscle, taking origin from the second, third, fourth rib, and it is continued like this. Triangular muscle. This triangular muscle is taking origin from here and inserted over this coracoid process. Okay. So that fascia is taking origin from the clavicle, then it gets united and again it covers this muscle and it is continued in the axilla. That is called clavipectoral fascia. So this anterior and posterior lips are for the attachment of one fascia which is called clavipectoral fascia. Why pectoral? It covers, its starting point is clavicle, then it goes down and then it resplits and covers the pectoralis minor muscle and goes down towards the axilla. So it is called clavipectoral fascia. Fascia means, what is fascia? It is a membrane, white membrane like structure. It is a white membrane like structure. তোমরা তো দোকানে যে তোমাদের এই আমাদের যে ছোট ছোট পাঠার মাংসগুলো ঝোলানো থাকে তার কিন্তু সাদা সাদা একটা মেমব্রেন লাগে না, that is the fascia. That is the fascia. So one fascia which starts from the clavicle covers the pectoralis minor and is continued below, which is called clavipectoral, because pectoral it covers the pectoralis minor, then it's continued to the axilla. Clavipectoral fascia. Okay. So how we can hold it in anatomical position? I can hold it like this also. The medial 2/3 is convexity forwards, lateral 1/3 is concavity forwards. But here the subclavian group will look upwards. It is remaining below. So first we have to search for the ends. Okay, which one is lateral, which one is medial, or which one is acromial, and which one is sternal. Acromial end is flat and sternal end is quadrangular. Okay, clear? Then we will search for the subclavian groove and we will keep it below. Now the sternal end is a bit in anterior plane than the acromial end, and in case of male this acromial end is a bit above, because males are muscular, they have got they are more muscular impression, they do the laborious work sometimes, so that end is at the upper level. So this is the anatomical position. And in case of female, this sternal end is always, it will remain a bit in front and the acromial end is a bit behind, and both the ends are in the same plane. So either you can hold it like this, and it's a pen holding fashion. How you will hold it in anatomical position? This is like pen holding fashion. তোমাদের ওই দুটো গেল কোথায়? পেন হোল্ডিং ফ্যাশন। এবার ধরো সাবক্লেভিয়ান গ্রুপটা কোথায়? তাহলে ওটাকে উপরে ধরে রেখেছো কেন? নিচে নামাও। প্রথমে কোনটা ল্যাটারাল আর কোনটা মিডিয়াল? ল্যাটারাল মিন অ্যাওয়ে, এটা ল্যাটারাল। We should hold it in with right hand and this is the left. How we can identify this is left? This is the sternal end should be towards the midline, and this is the acromial end should be away from the midline, that is lateral. This is medial end or sternal end, this is the lateral end, and this is the subclavian groove will remain below, and the sternal end will remain a bit forward, and acromial end should be a bit backwards, and like this, and we have to, you can elevate this end in case of male, and if you think no this is female, okay. আরেকটা কোথায় গেল? দাঁড়াও, দেখো এটা দেখো সাবক্লেভিয়ান গ্রুপ, সেটা নিচে করে দেবো। এটা কি ফিমেল এর? কারণ কি সেম প্লেনে আছে? সেম প্লেনে তো আমি করলাম, এবার যদি আমি তুলে দিই তাহলেই তো হয়ে গেল। আমি মেল বানিয়ে দিলাম, দুঃখ হলো? তোমার ফিমেলই চাই? তুমি চাই যে এটা ফিমেলই হোক, তাহলে ফিমেল হোক, তাহলে এরকম হয়ে যায়। তুমি যা চাইবে, দেখো ভালো করে ধরো ওইটা কোথায়? আরেকটা এই দেখো সাবক্লেভিয়ান গ্রুপ দেখতে পাচ্ছ, এই যে দেখো। তাহলে এটাকে মিডিয়াল, তুমি আমি তো এইভাবেও ধরে রাখতে পারি, এটা রাইট সাইডের মতো করে, দেখো এটা কনভেক্সিটি ফরওয়ার্ড, মানে এই বলে দেবে নো নো নো, রং 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 রং, রাইট রাইট রাইট, মানে তখন সে বলছে রাইট হচ্ছে না পুরো, রাইট রাইট। এই যে বাবু তলায় সাবক্লেভিয়ান গ্রুপ, সব কটাতে কি একই রকম ভালো ভালো পাবে? এইতে এরকম অদ্ভুত পেয়েছে বলে আমি এটাকে নিয়ে নিয়েছি। এই যে আচ্ছা এবারে এসো, এবার ল্যাটারাল ওয়ান থার্ডে আসছি। Now we will come to the lateral one third. In the lateral one third, on the lower surface of the lateral one third, we can see one tubercle on the posterior border. Tubercle means and bony elevation is called the tubercle. You can see this one bony elevation. What is tubercle? There are several words like tubercle, tuberosity. Tubercle means small bony elevation, and tuberosity, a big bony elevation. This is called greater tuberosity. This is called lesser tuberosity. So here we can find one tubercle. সবগুলোতে পরিষ্কার থাকে না, আমি তো যেটা ভালো সেটা নিয়েছি, এইটা দেখো। তুমি ধরবে কিভাবে, তুমি চিনতে হবে, তোমাকে তো লোয়ার সারফেস আর ইয়ে সারফেস চিনতে হবে। এই দেখো সাবক্লেভিয়ান গ্রুপ, এটা হচ্ছে টিউবারকেলটা, ঠিক আছে, ঠিক আছে। So we can find one tubercle at the junction of medial 2/3 and lateral 1/3 and on the posterior border. This tubercle is called conoid tubercle. Remember, this tubercle is called the conoid tubercle, and from here one linear elevation which is called tuberosity or ridge. Linear impression is called the ridge. Linear impression is called the ridge. ভালো কিছু না থাকলে কি করে দেখাবো? You can see linear elevation, ridge, border. So this is the tubercle and this is the ridge. From here we can find one linear ridge. In the lower surface. দেখো ইনফিরিয়র সাইডে দেখো, এখানে একটা টিউবারকেল, এখান থেকে রিজ। This tubercle is called conoid tubercle and this is called trapezoid ridge. Conoid tubercle and this is the trapezoid ridge. এই দেখো in lateral 1/3, medial 2/3 টা ভুলে যাও, যা পড়েছো ভুলে যাও। In the lateral 1/3, junction between the medial and lateral 1/3, you will get this ridge, tubercle at the junction of medial 2/3 and 1/3 and on the posterior border. On the posterior border. From here we can see one ridge is going. Ridge mane, what is ridge? Ridge is a linear elevation. This is conoid tubercle and this is the linear ridge. This is called trapezoid ridge. Conoid tubercle and trapezoid ridge. Okay, হাত দাও। tubercle and from here দেখো linear ridge দেখছো না, এই দেখো এই ridge. What is ridge? Ridge is a linear elevation in the bone. Ridge, ridge means elevated area. এই দেখতে পাচ্ছ, elevation দেখতে পাচ্ছ তো, linear. So this is called trapezoid ridge. তোমরা অনেক দূরে যাচ্ছ, কাছে এসো না, কোথায় দূরে বসে আছো, সিনেমার একদম ইয়েতে পেছনের দিকে চলে গেছে। এটা যে conoid tubercle, From here, you can see one ligament. Can you see this ligament? From coracoid process of scapula to the clavicle, you can see one ligament. So the name of the ligament should be from the coracoid process of the scapula, from the coracoid process of the scapula to the clavicle. This ligament should be called as coracoclavicular ligament. It is a very, very strong ligament through which the weight of the superior extremity passes through. When I pull, there is a normal reaction that goes to the humerus, then from here, this is the glenoid cavity of the scapula, this is a coracoid process, then through the coracoclavicular ligament, it is transmitted to the clavicle. From here, the joint between the clavicle and this is the costal cartilage, and ultimately it passes to the first rib, and ultimately it reaches the vertebra and it goes down. So that ligament is very strong ligament of the body. One of the strong ligament of the body, that is a coracoclavicular ligament. So coracoclavicular ligament has got two parts. One is conoid part and trapezoid part. Conoid part and trapezoid part. Conoid part and trapezoid part. So this conoid part is for the conoid tubercle, and trapezoid part, the linear impression, that is a trapezoid ridge, is for the trapezoid part of the coracoclavicular ligament. So there is constant wear and tear, so these impressions becomes very evident. Okay, from birth onwards, there is wear and tear. The body weight, the weight of the superior extremity passes through this ligament. So this impressions becomes very prominent gradually. So this is conoid part and the trapezoid part of the coracoclavicular ligament. Clear? Now we can find this is the anterior border of the acromial end. This is the posterior border of the acromial end, or lateral 1/3 of the body, and this is the anterior border, and this is the posterior border. So at the posterior border we are getting the conoid tubercle, and from there we are getting trapezoid ridge. Now this anterior border of the lateral 1/3, that means here, okay, from here one muscle takes origin and it is inserted over this region, one triangular muscle which is taking origin from the clavicle, from the acromial process, from the lower lip of the spinous process. The muscle actually is a triangular muscle, it comes down and it is inserted over this area where we inject any drug. This muscle is called deltoid muscle. Okay, deltoid muscle. This is the deltoid muscle where we put the injectable drugs or injections. So that deltoid muscle takes origin from the anterior border of the clavicle from the acromial process, the lateral border of the acromial process, and inferior border of the spinous process of the scapula, and it goes down and ultimately inserted over the deltoid tuberosity of the humerus. So this anterior border is for the deltoid muscle, and in the anterior border we can feel a tubercle. Tubercle means small bony elevation. That tubercle is caused by which muscle? Deltoid muscle. Deltoid muscle is always pulling. So that is called deltoid tubercle. So in the anterior border of the, here we can get the deltoid. হাত দাও মামুনি, sophisticated হলে হবে বাবু। এইখানে তুই কোথায় হাত দিচ্ছ? এইখানে দেখো, এই বর্ডারে তুমি ফিল করলে হবে, এখান দিয়ে দেখতে হবে এইভাবে, একটা উঁচু জায়গা তো, দ্যাট ইজ কল deltoid tubercle. এই দেখো হ্যাঁ, that is a deltoid tubercle. Similarly, the posterior border of the lateral 1/3 is also for attachment of another muscle which is called trapezius muscle, which looks like a trapezium, which has got extensive origin from the back. Okay, extensive attachment from here, it is attached here, it is attached here, then it is attached over the spines, it is attached over the occipital bone, that is called trapezius muscle. Okay, so trapezius muscle is inserted. You can find one blue area is for insertion, red area is for origin, blue area is for insertion. So trapezius muscle is inserted here, trapezius muscle is inserted over the upper lip of the acromial process and the lateral border of, upper lip of the spinous process and the medial border of the acromial process. Okay, so that is, and also the posterior border of the clavicle. Okay, here you can remember deltoid, trapezius is top and deltoid is down. This upper lip of the spinous process is for the top, for the trapezius, and lower lip is for the down, for the deltoid. Deltoid is down and trapezius is top. So this trapezius muscle is inserted on the posterior border of the lateral 1/3 of the clavicle. Now what are the joints which this clavicle is forming? You can see this joint between this clavicle and the sternum, and also this joint is also attached to the, there we can see one that there is one articulation of the joint between the first rib and the clavicle. So this joint between the sternal, there is one notch. There is one notch which is called clavicular notch of the sternum. Okay, so sternoclavicular joint, and this is the between the first rib and the clavicle, which is called costoclavicular joint. Sternoclavicular and costoclavicular joint. Okay, this sternoclavicular joint is a synovial joint. there is movement. But the joint is a complex joint because it is been separated by one articular disc. Okay. And there is joint capsules. That means that one capsule actually surrounds this joint. The capsules are attached at the articular margin on the respective bones. Okay, there is a joint capsule and it is lined inside by a synovial membrane, and this joint cavity is divided into two components, okay, by the articular disc. Okay, that is sternoclavicular joint. And other ligaments, one is in front, one is behind. Anterior and posterior sternoclavicular joint, clavicular ligament. One is anterior ligament, one is posterior. So anterior and posterior sternoclavicular ligament, and one is capsular ligament. Okay, that is for the sternoclavicular joint. Similarly, costoclavicular joint, between the costa, this rough area on the rough area is for the costoclavicular joint. Okay, clear? Is it clear or not? কোথায় মিস আছে? এই তো লেগে আছে, এই যে লেগে আছে, এই যে লেগে আছে। Anterior and posterior sternoclavicular ligament, and this is the costoclavicular ligament. এই যে costoclavicular, দেখা যাচ্ছে এটা, তাহলে তো একদম লিভিং বডিতে যখন থাকবে ক্যাপসুলটা লাগিয়ে দিয়ে, তখন ওটা তো লিভিং বডি থেকে ক্যাপসুলটাকে ছাড়িয়ে নিয়েছে, ক্যাপসুলটা থাকে তো এতটা জয়েন্ট স্পেস থাকে, আমি তো এরকম লেগে থাকবে না, জয়েন্ট স্পেস থাকবে, নাহলে সাইনোভিয়াল ফ্লুইড থাকবে, সাইনোভিয়াল মেমব্রেন থাকবে, আর্টিকুলার ডিস্ক থাকবে, তাহলে এতটা গ্যাপ থাকবে। তুমি কি জয়েন্টে এরকম দেখো যে এক্সরেতে ছেটে রয়েছে? সবসময় সেটে থাকা ভালো না, একটু দূরে দূরে থাকা ভালো, তাই না? ব্যথা হবে, বুঝেছো? So this is sternoclavicular joint, and there is another joint between the, we can find one facet here, and we can find this facet here. This is a acromioclavicular joint. This is a plain synovial joint. Plain synovial joint. This movement is there. Plain synovial joint. Okay. আচ্ছা, এখানে আমি একটা লিগামেন্ট ভুলে গেছি বলতে। So this is anterior and posterior sternoclavicular joint, like ligament, and another T-shaped ligament is there. There is one ligament which has got T. This is a vertical part of the T, and another is the horizontal part of the T, which is called interclavicular ligament, in between two clavicule, which is called interclavicular ligament, which is T-shaped, and the stem of the T is attached over this area. This is called the suprasternal notch. This is called suprasternal notch. So this ligament is T-shaped. Vertical part of the, or vertical stem of the T is attached here, and the horizontal parts are attached over the respective clavicle. So interclavicular ligament. So that sternoclavicular joint has got joint capsule or capsular ligament, anterior and posterior sternoclavicular ligament or interclavicular ligament, okay, which is present over the suprasternal notch. That area is called the suprasternal space of bird, suprasternal space of the bird, where we will get the interclavicular ligament. Hello? Now about the ossification, process of bone formation. Long bone, so it should have at least one primary center. Here we will get two primary center which appears on 4th to 5th week. That means 20 days to 25 days of intrauterine life, and both appear in membrane. Okay, though it's a long bone, but it ossifies in membrane, partly membrane, partly cartilaginous. So they appear in the body or the shaft, and these two ossification centers joins shortly at around 45 days. This is the first sign of ossification we can find in the body, whole body. Where? In the clavicle. When we perform the USG, the sonologist always search for, he or she searches for the ossification of the clavicle. There is one clinical condition which is called cleidocranial dysplasia, where the clavicle is missing. If the clavicle is missing, what will happen? Both the shoulder will be towards the midline, which is called cleidocranial dysplasia. অনেক সময় দেখেছো, where clavicle is missing. So that anomaly scan, during our anomaly scan, we have to find whether the ossification centers have appeared or not. So this is the primary center. Primary center is the center from which the major part of the bone ossifies. Major part means body. And secondary centers for the ends, from where the minor part of the bone or accessory parts of the bone ossifies. For the sternal end, we can find the secondary center. This is the epiphysis and this is the diaphysis. The secondary center, that is for the epiphyseal center, which appears at around 18 years of age, on attainment of 18 years. And that part ossifies or joins with the shaft at around 25 years. That means late joining. So this is the first bone where we can find the first sign of ossification, and this is the bone where we can see the late completion of the ossification. Or okay. Any clinical? Yes. Acha. What are the relation? What are the relation of medial 2/3? We can find the neurovascular bundle from the neck is either it is coming down from the neck or coming from the thorax. But we know there is arch of aorta. There is aorta, there is arch of aorta. Aorta, it originates from the left heart. Okay. So arch of aorta has got 3 branches. One is brachiocephalic artery. This is left common carotid artery or left subclavian artery. Okay. And this brachiocephalic trunk then divides into right common carotid artery and right subclavian artery. And this right subclavian artery goes to the right upper limb. Left subclavian artery is the direct continuation of the aorta. it is going to the left superior extremity, and left common carotid artery is going to the neck and head region. So medial 2/3 is related or medial 2/3 of the right side and left side, they are related. This side is related to brachiocephalic artery and this side is related to left common carotid and left subclavian. Okay, the sternal ends. And this on this lateral part we get one neurovascular structure, neuronal structure, that is the brachial plexus, which takes origin from the cervical nerves and thoracic nerve. Okay, first thoracic nerve, and it comes down, and it supplies the brachium. That means not only the arm, brachium means arm, also forearm and hand. There is a brachial plexus, most important plexus you have to know. That is a brachial plexus. Plexus means network of nerves. So that brachial plexus takes origin from the cervical and thoracic nerves. It comes down. Okay. And also some muscle. What is just remember scalenus anterior and scalenus medius muscle. There are two muscles from the cervical region and it is inserted over the first rib. Scalenus medius anterior and scalenus medius. In between two muscles, that brachial plexus is coming down and it is related to the posterior aspect of the medial 2/3 of the clavicle, as well as the artery, left subclavian artery on the left side, right subclavian artery on the left side, and left subclavian and right subclavian vein on the left and right area. Okay, so nature has purposefully made this convexity to accommodate the great vessels and nerves. Nature তো এটাকে সোজা করে দিতে পারতো, করেনি। Nature is very miser. All these things nature has made purposefully to accommodate the vessels, and also we get the root of the lung. Root of the lung. Lung is there. The apex of or the root of the lung is related to this medial 2/3 of the clavicle. Okay. Bujhle? Now about the clinical anatomy, the clavicular fracture. In clavicular fracture, the vein is just that the subclavian vein is just behind the clavicle, but there will be no affection of that vein because of the fact there is subclavius muscle is in front. In front of the vein, we will get the subclavius muscle. Bolam the subclavius muscle is taking origin from the first rib and it is inserted in the subclavian groove, which protects this vein. Otherwise, there would have been a torrential hemorrhage, which is prevented by the subclavius muscle. Okay, so in case of clavicular fracture, there is no hemorrhage because it is protected by the subclavius muscle, যেটা আমরা জানলাম এতক্ষণ আগে, মনে আছে? Subclavian groove, subclavius muscle taking origin from the first rib and insertion on the clavicle, which protects this vein. So bhalo holo. What is the effect? Nothing. What is the treatment? Nothing except figure of 8 bandage. Figure of 8 bandage is given. Okay. বুঝেছো? Only figure of 8 bandage will help to heal this clavicular fracture. No active treatment is needed. Other active or surgical intervention is not needed except the figure of 8 bandage. Okay. So, what is the anterior relation of the clavicle? Skin. Skin is there, skin, and below the skin there is a subcutaneous muscle which is called platysma. You can see in some animal like cow, if there is, you can see any fly is sitting on their body, there is continuous movement of the body, of the movement of the skin. This is because of the fact there is a subcutaneous muscle. Those muscles are called paniculus carnosus muscles. Subcutaneous muscles, they are named as paniculus carnosus muscle. There is only muscle we can find in the body. There is a platysma muscle which is taking origin from the chest and it is inserted over the face. You can find the platysma muscle. So, platysma muscle actually covers the clavicle. So, covered by the skin, covered by the muscle, and also we are getting the supraclavicular nerves. So, we cannot find the fracture ends outside, but it is being protected by platysma muscle. Not only skin, but also the subcutaneous muscle which is called the platysma. Platysma muscle, go through any a nature or anything, you can see what platysma muscle in the neck. Ekhano ache dekhbe platysma muscle.